Governor, you spoke a moment ago about initiatives at the state level, and there is a lot of reform going on in various states at the moment. What do you see out there that appeals to you?
Several things that either are being done or need to be done, and most of them are happening at the state level. One, innovations in the way that we provide coverage to the most vulnerable. For example, in Arkansas, we did it for children, and we did it for the employees of small businesses. That was where government found solutions partnering with private sector as well as employers and employees. I think many states, and I would point out states led by both Democrat and Republican governors. This is the wonderful thing about states' innovations. It's really not a left-right, Democrat, Republican, typical liberal conservative kind of issue. It's not horizontal. It's vertical. And many governors, Phil Bredesen of Tennessee, Mitch Daniels of Indiana, I can think of, both, though one is a Democrat, one's a Republican, Mark Sanford in South Carolina, a number of governors that come to mind on both sides of the aisle have come up with ways to create incentive programs to encourage people to healthier living. I know in Arkansas, we started doing things, for example, we eliminated copays and deductibles for screenings on mammograms, prostate cancer exams, and colonoscopies for all of our state employees because it was in our best interest as an employer that they get the screenings. We started giving people walk breaks, not just smoke breaks, so that if people who by law had to get their breaks to go take a smoke break were able to go outside and do that. What about the people that wanted to exercise? We used to tell them, do it on your lunch hour or before or after you get to work. Well, why?
Governor, if we can for a moment just go back to this idea of access. The state at the moment making headlines, of course, is Massachusetts. How do you evaluate that program? What do you think of it?
Well, right now it's not yet implemented, so really nobody has an opportunity to know whether it's going to work and what the ultimate cost is going to be. But the initial indications are that it's already going to be far more costly than anything that was projected. And part of it is that if government creates a mandate, which is what they did, but they aren't sure exactly where it's going to be funded, it'll ultimately result in higher cost to the taxpayer, and somebody's going to have to foot that bill. I mean, it's a wonderful experiment. I'm anxious to see how it's going to work and what it will do, but we don't yet know because it's right now a proposal that has not been fully executed.
Okay, and a question about your personal experiences. Of course, your story about your dramatic weight loss and your exercise program is well known, but I'd like to go a little further back in your biography and find out if either you or any family members at any time were uninsured, and if you were, how that may form your views today.
When my wife and I got married, and we married just before our 19th birthdays, we had just finished our freshman year of college, the one thing my father insisted on was getting health insurance, for which we paid $17.83 a month for a policy. We thought that was about the dumbest thing that was imaginable. But, we dutifully said, okay, we'll do it because, that's kind of what you insist on. And less than a year later, my wife was diagnosed with a malignant tumor in her spinal canal. We went through months of surgery, radiation therapy, learning to walk again for her. And I look back and I think, my father had to be the smartest, wisest guy in the world to have encouraged us. Now, what happened, because of that catastrophic illness for her at age 19, almost 20 at the time, she was virtually uninsurable for the next decade. We had to keep that policy. And it was one of those things where every time we tried to maybe change a policy or add something, it was impossible. So I do understand the incredible just mental anxiety of being a person who's uninsurable. Because we had that coverage, they couldn't just drop us. But, boy, the rates went up, and, we went through many things with it. And I think I have an unusual level of empathy for people who go through what I consider a real form of terror. We hear about all the forms of terror today that we face. It's real terror. There's a single mom working 2 jobs, and she knows that if her kid breaks his arm on the playground at school, she doesn't know how to possibly get that fixed and make the rent payment at the first of the month.
Governor, a final question on a very different subject, and that is the question of the AIDS epidemic in the United States. As you know, it has a disproportionate effect on African Americans. What would your administration do about that?
Well, it's not only AIDS that has a disproportionate effect on African Americans, but also hypertension, stroke, diabetes. So I think that anytime you have a disease that's affecting a disproportionate segment of the population, you need to concentrate resources. So we would do that. And, again, I've got a record of that in Arkansas. We put a disproportionate share of our total healthcare resources in the Delta, where we had the highest concentration of poverty as well as African American population. It's one of the reasons that I ended up getting 49% of African American vote in my state, which is highly unusual for Republicans. But people knew that I was colorblind when it came to trying to really look at issues that affected the quality of life for individuals. And in the case, whether, again, it's AIDS or diabetes or any other issue, oftentimes there is a correlation between high levels of poverty, pockets of poverty, and intense pockets of disease and challenge economically.
Governor Huckabee, thank you very much for your time today, and safe travels as you go through Iowa.
Thank you very much, Jackie. It's a pleasure visiting with you.
The Kaiser Family Foundation presents Health08.org, election news, analysis, and events.